after 5 days of arduous negotiations, after sleep-deprived nights and marathon negotiating sessions, we have a bipartisan agreement on the largest rescue package in American history. This is not a moment of celebration, but one of necessity. We have the anguish of the American people wondering about the future of their health, the health of their loved ones, and the economy, necessitates us to do all we can to help them and help our country. From the very beginning, Democrats have had two primary goals: a Marshall Plan for public health workers and hospitals on the front lines, and putting workers first. The agreement, now, after these 5 days, reflects those Democratic priorities, and we are proud that they are now part of this legislation. Like all compromises, this bill is far from perfect, but we believe the legislation has been improved significantly to warrant its quick consideration and passage, because many Democrats and Republicans were willing to do the serious and hard work. The bill is much better off than where it started. Democrats have succeeded in making the bill substantially better on many counts. Here are four major pillars of the bill. First, a Marshall Plan for our hospitals and medical needs. There is much more money for our hospitals, for our nurses and physicians, for our nursing homes, for our community health centers to do the job they need to do. Over $130 billion. Second, workers first. So many people are being put out of work through no fault of their own. They don't know what their future is going to be like. How are they going to pay the bills? Well, we come to their rescue. And the most significant part of that is something we are proud to have devised. We call it unemployment compensation on steroids. Every American worker who is laid off will have their salary remunerated by the federal government so they can pay their bills.
Well, Madam President, I have an update for the information of all senators and for the information of the American people, and it's good news. It's good news for the doctors and nurses in emergency rooms around the country who are waiting for more masks and more funding. It's good news for families all across America. At last, we have a deal. After days of intense discussions, the Senate has reached a bipartisan agreement on a historic relief package for this pandemic. It will rush new resources onto the front lines of our nation's healthcare fight, and it will inject trillions of dollars of cash into the economy as fast as possible to help American workers, families, small businesses, and industries make it through this disruption and emerge on the other side ready to soar. The Bipartisan CARES Act will squarely address each of the four big priorities that I laid out in my legislation at the beginning of the process about a week ago. It will rush financial assistance to Americans through direct checks to households from the middle class on down, and through a significant and creative expansion of unemployment insurance during this emergency. It will deliver historic relief to Main Street America through hundreds of billions of dollars in emergency loans so more small businesses can survive this and keep paying their workers. It will help secure our economic foundations and stabilize key national industries to prevent as many layoffs as possible, while keeping big companies accountable, as both sides have sought to do. And of course, it will push major relief to hospitals and healthcare providers, invest in new medicines and vaccines so we can beat this virus faster, and help get more equipment and masks to the frontline heroes who put themselves at risk to care for patients. In effect, this is a wartime level of investment into our nation. The men and women of the greatest country on earth are going to defeat this coronavirus and reclaim our future. and the Senate's going to make sure they have the ammunition they need to do it. I'm thrilled that we're finally going to deliver for the country that has been waiting for us to step up. I'm relieved my distinguished Democratic colleagues are ready to take yes for an answer. This has been a long week for the Senate, but it's been a much longer week for the hundreds of millions of Americans who find themselves in this strange new reality, where every morning brings new worries about their health, about their loved ones, about whether their job or their small business will still exist at this time next week. So, Madam President, help is on the way. The American people are already rising to this grave challenge, and the Senate is about to follow suit.